Hey, my name is Emily Holcomb, and for this video demonstration, I will be demonstrating how to do bird dog planks. So for this exercise, the targeted muscles that are used are the erector spinae, which are your spinal muscles, your internal and external obliques, the rectus abdominis, which are your abdominal muscles. The synergist muscles are the gluteus maximus, or your buttocks muscles, your hamstrings, your anterior deltoids, which are your front shoulder muscles, your lateral deltoids, which are the back shoulder muscles, your middle and lower trapezius, which the middle reason helps with the retraction of your scapula, and the lower helps to rotate and depress the scapula. Stabilizers are your internal and external obliques, which are both side muscles, your rectus abdominis, your abdominal muscles, your iliopsoas, which are your inner hip muscles, your sartorius, which is your inner thigh muscles, your tensor fasciae latae, your thigh muscles, your quadriceps, which are your front thigh muscles, your pectoris major, which are your chest muscles, your triceps, which are the back of your arms, and your sartorius anterior, which are your muscles in your thorax, where your ribs are. So for this exercise, you want to make sure that you are comfortable with both planks and bird dogs before you add them together and before performing your reps and sets. And then once you are comfortable with both forms together, you can add 2 or 3 sets for 30 to 1 minute. And this is a full body workout. So bird dogs and planks are 2 separate exercises that have been put together as variations to each exercise. They both are performed as floor exercise, and they're used to strengthen the core and your abdominal muscles. And as you work this exercise, you're working the muscles from your neck to your shoulders, your spine, your gluteal muscles, your thigh muscles. The benefit of this exercise is to use the exercise technique to help build with lower back functioning. It helps to engage your core muscles as well as your back muscles at the same time. It allows for rotation of muscles in the spine and helps with extending and flexing and improves stability and posture. The exercise is good for all age groups. If you have a lot of injuries, that are pre-existing, you might not want to do as much, or you might want to wait till it's healed. But it helps to prevent the body from injury and helps to increase your range of motion. So to perform this exercise, you begin by getting into the plank position, which is essentially the same thing as doing a push-up. And then you position your legs out straight with your standing on your tippy toes, or with your legs on your tippy toes, and your arms are shoulder width apart. You extend your right arm and your left leg, and then you extend your left arm and your right leg. And once you do that and you return back to your starting position, that would be what is considered 1 set. The proper form for this exercise is to make sure that you keep your spine, your head, your neck in a neutral position and keep those core muscles tightened. And then as you extend your arm and your leg, you want to make sure that you breathe in when you're extending and you exhale when you're going back to the starting position. For this exercise, the fitness component would be muscular endurance. This exercise helps to build that muscular endurance because it helps to prevent the injuries and stimulate good posture. Muscular endurance helps with coping with daily activities and jobs or fitness or sports that require enhanced performance or demands. Some variations to this exercise will be that you can add bands around your feet when you're performing it. You can add resistant bands to your ankles, which make a little more weight on your ankles when you lift your legs out. And you can add weights when you lift your arms. You can have weights in your hands. And that's that. So to perform this exercise, you get down in the plank position like a normal, version 1 of your plank. And you want to make sure that you're not holding your back down like this. You're holding your back up. And when you go to lift up, you lift up one leg. Oh, not like that, but you lift up one leg and come back down. And then you lift up the other leg and the arm while supporting yourself on your arms and your other leg. You can use weights to kind of keep your balance, or you can do the other side as well. So, thank you.